Good afternoon, everyone, and since this is the first media briefing of the new year, let me wish all of you a happy new year. This year is having a very difficult start, but we do hope that it will nevertheless bring better times ahead. Now, I'm going to say more in a few moments about the announcements that I set out in Parliament yesterday, but as usual, I will give you an update on today's statistics first. I can tell you that the total number of positive cases reported yesterday was 2,529. That represents 14.8% of the total number of tests, and it means that the total number of confirmed cases that we now have in Scotland is 139,027. Analysis of PCR samples also shows that the new variant is now responsible for around 50% of new cases in Scotland, and that is a proportion that is rising. 695 of the new cases today were in Greater Glasgow and Clyde, 388 in Lanarkshire, 322 in Lothian and 210 in Tayside. The remaining cases are spread across 8 other health board areas. 1,347 people are currently in hospital. Now, we haven't been reporting hospital and ICU figures over the New Year bank holiday period, but to give you some context for that figure today, I can tell you that it is 255 more people in hospital now than was the case a week ago, exactly a week ago today. And 93 people are in intensive care, and that is 28 more than a week ago today. 11 additional deaths have been registered in the past 24 hours of patients who first tested positive in the previous 28 days. Of course, yesterday was a bank holiday, so it is possible that this figure today is artificially low as a result of that, but it means that the total number of deaths reported under this daily measurement is now 4,633. And of course, every single one of these deaths, I report them here on a daily basis as statistics, but every single one of those statistics represents a human being who has lost their lives to this virus and will have left behind grieving families and friends. So again, today, my condolences and thoughts go to every individual and family who is in that situation. Now, I'm joined today by the National Clinical Director. He's going to help me answer questions in a few moments. But before we get to questions, I want to take the opportunity to emphasise the key points that I set out yesterday in Parliament. Firstly, just to reiterate that the current situation we face now in the pandemic is, in my view, more serious than it has been at any time since the spring. And that's because this new, more transmissible variant of COVID is becoming increasingly common, as I said a moment ago. And as a result of that, cases are rising much more steeply and rapidly than they had been in the latter part of last year. And as a result of that, more people are likely to become ill, and the health service will come under more severe pressure. Now, that, of course, is the negative, the worrying position we face. And I don't say it for exaggeration. I say it because we all must take that seriously right now. But of course, there is a difference between now and last spring, and that is a positive difference. And that, of course, is the fact that vaccines have been approved for use in the UK now. And vaccines, as we know, does offer the way out of this pandemic. More than 100,000 people in Scotland have already been vaccinated, and as I set out in Parliament yesterday, we expect, although these timetables are still tentative, that by May more than 2.5 million people will have received vaccination, at least the first dose of the vaccination, and that includes everyone on what is called the JCVI priority list, everyone over the age of 50 and people under 50 who have specific underlying health conditions. Now, we will do everything we can to speed that up, to deliver vaccines as quickly as possible. And we will set out what our expectations are around that as the certainty we have on the flow of supplies becomes much firmer, I hope, in the days and weeks to come. But in the race we currently face, and I am describing it deliberately as a race between the vaccine and the virus, because that really is, in essence, what it is. We can't rely solely on speeding up vaccination. That's really important. But because this new variant is spreading so much more quickly, we must also act as we vaccinate more people to slow the virus down so that the vaccination can get ahead and ultimately be in a position where it wins the race. And the new variant, because it is easier to transmit and spreads more quickly, it means that slowing it down is more difficult, and that to achieve that takes much stricter restrictions than the ones that have been in place over the past few months. And that's why we got to the position yesterday of announcing what is effectively a new lockdown. And the key message we want to convey and are conveying and stressing very, very strongly is a simple message, not simple to abide by, but simple for me to communicate. And it's a similar message to the one I communicated for much of last year, and that is stay at home. Staying at home whenever possible is the best way now of protecting ourselves, protecting each other, protecting the NHS, and ultimately saving lives. There are, of course, specified essential purposes for which you can leave your house. These include exercise, essential shopping, providing care, perhaps for a vulnerable relative. And because extended households are still permitted to try and help us in some way tackle the loneliness and isolation of these restrictions, you can also leave your home to visit the other people in your extended household. But fundamentally, I'm asking everybody to really try hard to stay at home as much as possible and only leave home if it is for a genuinely essential purpose. And that means you must work from home as well if you can. In fact, it's only permissible to leave home to go to work if you cannot work from home. Now, businesses, employers have a big part to play in making sure that we can achieve that. The Economy Secretary spoke to business organisations yesterday to reinforce this message. And I want to be clear that we really need businesses in this next phase, as they have been throughout, to be responsible to help us fight this virus. And that means, just as this is true for individuals with the stay-at-home message, it means not always looking for the loophole that allows you to stay open or have your staff physically at work. Instead, it means thinking about how you as a business can maximise your contribution to the collective challenge that we all now face. And in return, government must do, and we will continue to do, all we can to maximise the financial support available to you. The Chancellor of the Exchequer has just announced this morning additional financial support for businesses, and we are, over the course of today, trying to get clarity on the detail of that so that we know what that then enables us to do in addition to the considerable financial support for businesses that is already in place. Now, returning to what lockdown means for all of us as individuals, we've also introduced tighter restrictions on outdoor socialising because this virus we know is spreading more easily. So it's still possible to meet someone outdoors, but only 2 people from 2 households can now meet up. Previously, it was up to 6 people from 2 households, but now only 2 people from a maximum of 2 households. That rule applies to everyone who is aged 12 and over, and that means that outdoor exercise should also only take place in groups of 2 and no more than 2 households. Now, we announced several other significant restrictions yesterday. You can find full details of these on the Scottish Government website, and where there is a need for it, we will put forward and publish additional guidance to help people navigate their way through this as well as we can. Now, one thing I want to mention specifically, because I know it is very distressing for many people, and that was the announcement yesterday that places of worship will close over this next period as well, except for funerals and weddings. I know for people in faith communities who take great comfort from collective worship, this is a particularly hard restriction to bear. But we do deem it essential at the moment to help us with that overall task of keeping the virus or getting the virus back under control. But we will not keep these restrictions in place for any longer than necessary. And of course, we have also very regrettably decided that school and nursery buildings will only be open for children of key workers and vulnerable pupils until at least the 1st of February. During that time, remote learning will continue for the majority of pupils, and this is, without a doubt, I said this yesterday, but it's worth repeating, the most difficult of the restrictions that we put in place yesterday. And I know how tough it will be for pupils who, as well as missing education in the normal school environment, will be missing your friends, and the normal social aspect of growing up and enjoying your school life. And I'm sorry about that, and we will try to get you back to school as quickly as possible. But this is also difficult for parents, particularly those who are working while trying to juggle childcare and online learning. And we are thinking about what more support we can put in place to help you through this difficult period. The decision on schools will be reviewed fortnightly, and we will do everything we can to get as many pupils back to school as soon as it is safe to do so. But at the moment, the community transmission of the virus is too high and still rising, and also there is some uncertainty about the impact of the new variant on young people, and those two things together lead us to the judgment that it is not safe enough to have schools open right now for the majority of pupils as normal. Now, the measures that were announced yesterday that I've just run through here today are, of course, not the start to this year that any of us would have wanted. They're really tough for businesses, for individuals, and as I've said a couple of occasions already, we will consider what further support we are able to provide. But the current figures, including those I've reported today, tell us that action is needed. This new variant is so much more easily transmitted that without these tougher restrictions, cases in Scotland would definitely continue to rise very, very sharply. And that, of course, creates the likelihood that more people get ill and die than would otherwise be the case, but it also creates the real risk that our National Health Service, which is currently coping, although the pressure on frontline staff is considerable, but it creates the real risk that it would instead be overwhelmed, and perhaps quite quickly. So by acting now, instead of waiting until things get more severe, we give ourselves the chance to avert the more serious challenge that is currently being faced in some other parts of the UK right now. I know that doesn't provide any comfort, and nor does it provide comfort for me to say that we're not alone, but we're not alone. People in England, Wales, Northern Ireland are waking up today to similar restrictions, and many other countries across Europe are in similar positions. But while this is hard for everybody to take, we must hold on to the fact, and it is a fact, that we now have, in a way we didn't last year, have a clear route out of this pandemic through the vaccination programme. And the Scottish Government will be doing everything we possibly can to accelerate, speed up that programme and get the maximum number of people vaccinated as quickly as possible. But while we're doing that, we absolutely must, all of us collectively, work to slow down this virus. That's why these measures are essential, and it's why, again, I must ask everybody to really rigorously abide by all of these restrictions. That means following the facts advice, wear face coverings, avoid crowded places when you are out of your house, which you shouldn't be unless it's essential. Wash your hands, wash hard surfaces, even when you are staying at home. It's really important still to do that. Keep a 2-metre distancing when you're out from people in other households. And, of course, self-isolate and get tested if you have symptoms. These steps all still work in breaking the chains of transmission of this new variant and remain as important, if not more so. But fundamentally, the most important thing and the most difficult thing I'm asking everybody to do again is to stay at home. Staying at home helps us control this virus. It helps us protect ourselves and each other. It helps us protect our NHS, and fundamentally and ultimately, it helps us save lives. And that, as we have all known all along, is really important. So my concluding message is the same as it was back in March, because the situation we face now is as serious as the one we faced back in March. So please stay at home, protect the NHS and save lives. Thank you very much for listening. I'm going to hand over briefly to Jason to say a few words before we take questions as normal from the journalists.
Thank you, First Minister. I'm going to just briefly put these new safety measures into some kind of context using principally statistics. Though this pandemic is now nearly a year old. I've used this comparison here before, but the Ebola pandemic in 2014 infected 34,000 people globally. 34,000. Tragically, 12,000 of those died. This pandemic, that's now just about a year old, has today infected 85.6 million people. 518,000 people caught this virus yesterday. It has killed 1.85 million people globally, and 10,000 of those died yesterday, or had their deaths registered yesterday. The numbers are unthinkable and unimaginable. The best way of comparing country with country, region with region, is, as you all know, the 7-day average per 100,000. The WHO say you should try and get that to 50 per 100,000, and that would indicate some level of control. Scotland's most recent 7-day average is 259, the highest it's been for many, many months. Northern Ireland's is 473, Wales is 476, and England's is 518. There are now regions of England with a 7-day average rate over 1,200. Again, unthinkable just 2 or 3 weeks ago. And remember, this disease is the same disease. It still kills 1 in 5 over 80s who catch the virus. On the 19th of December, we both stood here with Gregor, the Chief Medical Officer, and we announced the reasons why and the decisions around the Boxing Day restrictions. On that day, on the 19th of December, there were 756 positives, and the 7-day rate in Scotland was 136. Today, there are 2,500 positives and 259 average over 7 days. We published yesterday a brief evidence paper to go along with that new guidance. The State of the Epidemic, it was called. And it says in the beginning of it, we have seen a step change in the incidence and prevalence of the virus, which we anticipate will lead to increased hospital admissions and mortality. We also, at the same time, published modelling using scenarios that cannot be definite. Modelling can never be truth. It can only guide us to truth. For hospital and ICU admissions, which show us reaching capacity within 3 to 4 weeks of now, if we don't do anything else. The why is now well understood. The prevalence, the transmissibility of this new variant is 0.4 to 0.7 increase in R. But, to finish, there are 2 things that we can do. One is new, one is old and slightly now boring. The new thing is the vaccine, and the First Minister has covered that, and it may be we take questions on it. The second, I'm afraid, is what each of us can do as individuals. Behaviour still works for the new variant. The new variant will still not transmit if you stay away from people and you stay at home, you wash your hands, you wash your surfaces, and you keep distanced. All those things that I know everybody knows so well. It remains the key to win the race where the vaccine catches up. First Minister.
Many thanks, Jason. We'll move straight to questions. Gordon Cree from STV.
Thank you, First Minister. The fact that we are in this situation again, does that represent a failure of us, the public, to do the right thing? Is it a failure of governments and governance, or is it just something that happens? And on vaccines, if I can ask both of you, you've talked about you're going to do everything you can to speed that up. And what can you tell us about what, in a practical sense, that might involve? Because I think the one thing that everyone seems concerned about is, does the infrastructure to vaccinate people keep pace with the availability of vaccines?
So on the first part of your question, I mean, I've never tried to shy away from the fact that governments have got things wrong, and my government has got things wrong. I've got things wrong in this, and that will undoubtedly continue to be the case. I will try very hard not to, but we are still in a really difficult, complex, challenging, in many respects, still unprecedented situation. But the position we're in right now, I don't think it is fair to characterise it in that way. It's certainly not fair to characterise it, or wouldn't be accurate to characterise it as a failure on the part of the public. We were, up until the sort of latter part of last year, in a very challenging position where we've had periods and of rising transmission where we had to put restrictions on again. But relatively speaking, certainly within a UK context and probably broader within a European context, incidence of the virus, case levels were lower in Scotland than in many other places. Now, did that say we were doing everything right? No, because it was higher than we wanted it to be. But it suggested that overall, the approach we were taking, while not perfect, was broadly working. And that was the position we were in. We had said before Christmas we didn't think it was working perfectly, so we were going to be reviewing the levels and the content of the levels. But broadly, we thought we had an approach that was capable, in general terms, maybe needing a bit of tweaking, of keeping the virus under control. what has changed? And I talked yesterday about there being two game changers here, the really good one being the vaccines, but the really awful one being this new variant, is that we're suddenly facing a virus that, it's the same virus, it's a different strain of the virus, but it feels like a completely different virus because it is transmitting so much more quickly, not just a wee bit more quickly, but perhaps 70% more quickly. And that just changes the whole picture. And that has then it's meant that the virus has been able to run ahead of all the restrictions that we were all living under towards the latter part of last year. So that has been a game changer. And, this whole thing has always been a bit of a race with the virus. We've now got the vaccines that we hope can beat it. So we have to up our game again to try to get ahead of it. The vaccines will help us do that. But while that's happening, we need to work harder to slow it down. So this is not a failure, which is not me saying we don't have things that fail and go wrong. Of course we do, and we have done, and we will continue, no doubt, to do. But this position we're in as of today is not some collective failure. Unfortunately, it's a success on the part of the virus to reinvent itself and get ahead of us again. And we have to work harder now to get back in front of it. On vaccination, really, the position is, as I set out in Parliament yesterday, we will update that position as often as we can. I'm trying to be reasonably cautious in what I say because I don't want to get into a position where we're, over-promising and not living up to these promises. So, we know with a reasonable degree of certainty the number of doses that we think we'll have over the course of January. I hope that when we're into February, looking back in January, that will have been more than the figure of just over 900,000 that I gave yesterday, but that's what we think we can rely on right now. So at the moment, we are wanting to get greater certainty around the supply schedules, but you're absolutely right to say that we then have to make sure that we have the infrastructure and the systems in place to vaccinate people in a way that keeps pace broadly with the flow of vaccinations. You'd always probably want to have a bit more supply so that you've got, a bit of a cushion in case you have some wastage or something like that. So you'd always want to have some doses in reserve. So you'll never want these two figures to be absolutely identical, but we need to keep pace with supply. Now, in practical terms, that it's very logistically complicated to deliver, but it's not complicated for me to describe. We've got to basically use all of the resources in terms of people who can do the vaccination at physical premises to get them done. With the Pfizer vaccine, that has to take account of the really difficult logistics around the delivery of it. And our vaccination team are working literally every day to make sure we are maximising that, and that will continue. This is, without a doubt, the most important thing that government has to undertake right now. It's massive. Will there be hiccups and problems along the way, days where I'm probably standing here getting lots of questions from journalists about things that maybe have not gone as well as we wanted? Undoubtedly, that will be the case. But overall, getting this vaccination programme up and running at pace and getting this vaccine into people's arms as quickly as possible is the most important thing we've got to do right now. Jason, do you want to add?
So the simplest way I've found, Gordon, of explaining the difference between the old variant and the new variant is the London and the South East having a pretty severe lockdown in November that previously got the R number to 0.7 and this time got the R number to 1.4. And we got exponential growth. So there's something definitely different about the nature of this virus. And therefore, you have to take appropriate steps, which you can see the London and the South East now doing, along with us. You need four things for vaccination to work across a population of our size. You need supply, which we can't guarantee, we can influence, but we cannot guarantee it. You need workforce, which we can influence, dentists, doctors, GP surgeries, nurses, as many people as we need to deal with that supply as it comes. We need places. We're giving that responsibility out to the health boards with us having oversight on it. We think that's the right way to do it. That's the way we've done Test and Protect. It's the way the public health infrastructure in Scotland works. That is going well. Just now that will be major centres in hospitals because that's the nature of the vaccine we have. It will move into GP surgeries. It will then move into mass vaccination centres. And each health board is planning what that will look like. That will be very different in a big health board the size of Highland compared to a smaller health board the size of Dumfries and Galloway. And you need people to turn up. And that's, I think, one of the key messages for the public. You must come. So when you are offered the vaccine, we really, really need you to get it. That's the fourth element.
All right, Glenn Campbell from BBC.
Hello, First Minister. Thank you. I want to talk a little bit more about the vaccine. You've said that you aim to vaccinate effectively half the population by early May, when the election is due, and that you hope to go faster. I wonder, how much faster would you like to go? What's the earliest that target could possibly be achieved? And what needs to happen to make sure that this programme can be delivered in the shortest possible period of time? I also wonder if you have any interim targets along the way. I noticed that Boris Johnson last night talked about vaccinating the over 70s, NHS and social care staff, care home residents and most vulnerable patients by mid-February. Is that an undertaking that you're able to give in Scotland as well? So
I understand why I'm being asked these questions. They're really important, really legitimate, and I will do my best to answer them as fully, as quickly and as firmly as I can over the days to come. But some of the questions you've just asked me there, I cannot answer right now. So if I tried to answer them, I'd be, you know, not far away from kind of making it up. And I don't think that's the way to treat this. So, you know, what I set out yesterday is what I think we can be confident about. So by early May, to have given at least the first dose, for some people on that list it will be the second dose as well, but at least the first dose to the whole of that priority list. So in summary, everybody above 50 and people younger than that with specific health conditions. Now, I hope that supplies, and at the moment, the biggest unknown that stops me being able to answer the question about how much sooner would I like to be able to do it, is I don't know beyond the end of January with enough certainty what the flow of supplies is going to be. So I can't yet say, I mean, the simple answer to the question, as quickly as possible. But to start now with any definition, to bring that May date forward, I need to have greater certainty on the flow of supplies, which I don't have right now. So I'm going to try and set this out as clearly but as frankly as possible. So the commitment the Prime Minister gave last night, standing here right now, I don't yet have enough certainty on the supply after the end of January to say categorically, looking down this camera, that we think we can do those first 4 groups of the priority list by mid-February, I think the Prime Minister said. Do I want to do that? Yes. If we get the supplies to allow that, will we bust every gut and, you know, move every mountain to try to deliver that? Yes, we absolutely will. But for me to say with certainty right now that we can do that before having the certainty on the supplies, I think we'd be putting the cart before the horse. And then running the risk, if the supplies don't come through, that I'm standing here explaining why we can, and then the risk is that undermines people's confidence in our ability to deliver. And remember, the supplies are a 4 nations thing, so we are working together on that. But I want, when I stand in Parliament or stand here and give dates, I want to be as certain as possible of our ability to meet those dates. And then if we don't meet them, and you know there will be things that don't go according to plan in this programme, then I can stand here and explain why, well, we said this then, but something changed and we've maybe had to amend that a little bit. So that's how we're going to try and do this. But underlying all of that is a determination. I want to get vaccines into folks' arms as quickly as possible, because that's the route out of me having to stand here every day and talk about case numbers and death numbers. So I want that as much as anybody else does. And we're giving this, you know, the greatest priority and focus that we possibly can to get it done as quickly as possible.
And when it comes to your bit, have you got all the people, all the expertise that you need to make it move as fast as you can when the vaccine supplies arrive? So
we've got fantastic people in the government working on this. Our vaccination team is extremely good and has already, you know, got a programme up and running. We have, you know, the latest figure will be published tomorrow, but, you know, well over 100,000 people now vaccinated. We've got people working across the health service and health boards. You know, there are people who are, you know, doing literally nothing else but making sure that this programme is working. We've got 2,300, I think, at the latest count, vaccinators registered to help with the vaccination. We have, after a particular company publicly made an offer last week, you know, my own, you know, email's been inundated with companies offering assistance. Not all of these offers of assistance will be practical to take up. It won't be that everybody that offers their premises or their staff, that it won't necessarily be possible for us to take that up. But we will explore all of these offers. So, you know, I'm not going to stand here and say I wouldn't like more resource and you know, because we want this done as quickly as possible. But this is a programme that has absolute focus of every level of the Scottish Government, and that is the way it will continue. Do you want to add anything? So. Peter Smith from ITN.
Thank you, First Minister, and Happy New Year to you both. You've spoken previously yesterday about the race that we now have between this vaccine and coronavirus, and how important it is that the vaccine can catch up. One cause of concern from scientists I've been speaking to is that there are mutations, and that the South Africa strain in particular is of a particular worry, because the scientists are saying that they're not actually 100% sure how effective the current vaccine that we're using will be against that strain, and they would be very keen for it to be kept out of the UK. When I asked you about international border closures, it was on the 23rd of October, I think, the last time I asked you about it, and you told me that you hadn't advocated for closures at international borders, and you were not asking Boris Johnson at that point in time to do that. Would you like now to see tighter border controls to stop new variants seeding in the UK, especially here in Scotland, if it does have a threat to derail the vaccine programme? And just a brief question for the National Clinical Director. Can you please tell us, Mr. Leitch, what do we know about the new strains, how they respond to the vaccines we have now, and how that could derail any vaccine programme? And based on the science, are you in favour now of tightening border controls to keep people safe?
I'll hand over to Jason in a second. I had a Four Nations discussion last night, chaired by Michael Gove from the UK Government, where the issue of border, stricter restrictions on travel, including controls at the border, was discussed, and there was an agreement in that call to take forward some urgent Four Nations discussions about that over the course of the days. And I think there's been some speculation from the UK Government about possible announcements soon, and we're part of those discussions. So yes, I do think that's important, and obviously when it comes to border controls, anything that involves border force, that is not a responsibility of the Scottish Government. It is for the UK Government, but there is I hope a willingness to be collaborative in how we make these decisions. But I want to stress, in answering that bit of the question, I want to stress something that perhaps just is still not well enough understood, which is my responsibility and my fault if that's the case, is that it is against the law right now to travel outside of Scotland or into Scotland without it being for an essential purpose. It's against the law from today to travel outside your home unless it's for an essential purpose. So you should not be going overseas unless it is essential, and you should not be coming into Scotland unless it is essential. Now, that's different to actual physical controls on the border, but that's the legal position. We have effectively said, travel is banned, and that is a message that I want to get across there very seriously. In terms of numbers coming, I was looking at some of the numbers for international travel just in the last couple of days, actually, and if you take December into our main airports, international arrivals into Scotland are a fraction, a very, very small fraction over the course of December 2020 compared to December in the previous year. So that's not to say we couldn't and shouldn't do more, but to give some context, actually international travel has really, really plummeted, and that's certainly important, and we want to make sure that we are not allowing new strains of the virus to be seeded into the country. Jason.
Yeah, so it's a global race. It's not just a Scottish race. It's a global race to vaccination, and the WHO are leading that on behalf of all of us. Mutations are expected. They are consistent. They happen. There are hundreds of different mutations of this virus around the world. We find them better in the UK because of our genomic sequencing work. The South African variant is a bit of a challenge because you can't find it from a proxy test. So you don't know if it's that variant. You have to do the genomics. We simply don't know if the vaccine will work with it. There is no reason to think it won't. People are just wondering, because it seems to be a very active mutation, a very transmissible mutation, that maybe it might not, but there is no science yet to prove that. It's being grown at Portendown in England, along with the variant of concern across the UK, and we will know just as soon as they know when they do antibody tests on it to see if it dies with those antibodies, and that will become, I'm sure, global news when that happens. We expect it to be still vaccine killable, if that's the correct expression. My travel advice, the public health travel advice, has been consistent since the beginning of the pandemic. Do not let people come from high prevalence areas to low prevalence areas, whether that's inside a local authority in Scotland, whether it's across national boundaries, or whether it's global. So do not allow people to come in and out of the countries without some kind of regulation and quarantine from high to low. That becomes even more important when the prevalence is low. And the summer and March prove that, if we needed it proven once again. Just now our prevalence is higher, so I'm less worried about travel, although still concerned about it. If we can get this prevalence down, travel becomes even more important than it is just now.
Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, within a month or so ago, areas like the south of Scotland, Dumfries and Galloway, and the Scottish borders had very low incidences of COVID. They were in low tiers, and there was plenty of capacity in the NHS. Now it seems that is not the case. Cases are on the rise, and you even referenced Scottish borders yesterday in your statement to Parliament. I'm just wondering, can you explain why that has happened? Is it because people have travelled within Scotland? Is it because the virus was in these places already and possibly the new variant? Is it because of cross-border travel? Because I assume that you need to know why this has happened in order to try and make your lockdown work.
I'll try again. We have a new strain of the virus that is transmitting 70% more easily. That's why it's happened. Sometimes, and I'm as guilty of this, guilty is not the right word, I'm as prone to this as anybody else, of always looking for, deep-rooted, complicated explanations for things so that you can sort of say, well, they're really out of the ordinary and therefore we can find a way of fixing them. This is a virus that will transmit if people come together, and if it's transmitting 70%, excuse me, I'm waving my hands about here, not in my normal way, but because there is a fly buzzing around me. If it is transmitting 70% faster, then we're going to see situations like you rightly say in Dumfries and Galloway, the borders. These are areas we moved down into level 1 not long before the end of the year because case incidence was so low. But the virus this new strain has got in there. That will undoubtedly be, to some extent, travel related because people will have brought it either returning from elsewhere in the UK or coming from elsewhere in the UK, and it's spread very, very quickly. And therefore now Borders is one of the 3 or 4 health boards that gives us the greatest immediate concern about hospital capacity. And that makes it all the more important that people in Borders and Dumfries and Galloway right across the country really understand the severity of this and understand why we are saying to people, stay at home, because the more people stay at home, the less likely you are to come in contact with other people and spread this virus or get this virus. So that's basically the most important message I can stand here and convey right now is for all of these reasons, staying at home is essential as far as you possibly can. James Matthews from Sky.
Thanks very much, First Minister. You spoke about the certainty needed around infrastructure and systems. Can you tell me how many vaccination centres do you need and how many have you identified? And Catholics, I beg your pardon, also Catholic bishops, they've said in the past that you have banned worship in places of worship. The UK government has not. They call that arbitrary and unfair. And they say there's no evidence to suggest that there is a danger. What is the evidence that there is a danger?
First of all, I'm not going to give you figures. I can't give you figures right now for how many places there will be that people will be vaccinated, partly because that work is ongoing, partly, as Jason said before, this will not just be about big centres of vaccination. It will partly and to a large part be about that, but this will also be about GP practices, community pharmacies, maybe dental practices, so that as supply gathers pace, we bring more of this on stream, and health boards all over the country are working with that on that right now. And we will, as this programme develops, we will be as open and transparent about how it's progressing. Obviously, we'll be open and transparent about where it's progressing, because people will be invited to come forward to places for their vaccination. On the Catholic bishops, I mean, I specifically referenced the decision we announced yesterday on places of worship in my opening remarks, because I know how horrible and tough and distressing this will be for many people. And all I would say to people, I don't expect everybody to agree with every decision I take, and I certainly don't expect everybody to feel happy or anything like it about possibly any decision I'm having to take in this context right now. All I would ask people to understand, even if they do it quite reluctantly, is that none of this has been done lightly. I have no interest in closing anywhere if it is not necessary to do. And I'll come on to the necessity and the evidence point in a second. And yes, that is one of the points of difference between Scotland and the UK, but so too is the fact that we've decided to act much earlier in the curve of this wave of the pandemic to get it under control. We are trying to act as cautiously and as precautiously as we can at the moment to stop this situation deteriorating any further. And that's why some of these really difficult decisions, as a politician, the tendency we all have, or the instinct we all have, is to avoid taking difficult decisions that will be unpopular. But right now, the most important duty I've got is to take the tough and unpopular decisions, because they are all about trying to keep the country as safe as possible. The evidence, again, it comes back to a point I made earlier on, Jason might want to add. We all have a tendency, me included, to look for the really complicated. What's the evidence about why the virus is transmitting here or there, or not here but there? Actually, it's much more straightforward than that. This virus transmits when people come together, and therefore we have to reduce as far as possible the places where people are coming together. And that does involve really difficult things, including the decision on places of worship. It's about taking away as many opportunities as possible for the virus to spread from one person to another. And, if I think about funerals, as you know, before Christmas, I had my own momentary lapse of, not wearing a face mask for a very short period of time at a funeral wake. And so I've got my own experience there of how there are some settings where it is even more difficult actually to do all of this, partly because of the emotion and the nature of them. So these are horrible decisions, and I don't expect any person of faith to be happy about this. But I do know that the churches have been incredibly helpful and understanding in this challenge. And I would simply ask that people, even if they don't agree with it, try to understand that we're not doing it lightly or for no reason.
A couple of things quickly. So the number of vaccination centres is thousands. We will use every GP surgery because that's a simple network that we have access to. And then we will have a very small number of big vaccination centres. We've published a little of that, of what we know just now, in the Scottish Parliament Library, and you can find the map of those places just now, but we will move that over time as we get supply. Anybody who knows me in any deep way will know how difficult it is for me to give advice that places of worship should close in Scotland. It is one of the hardest pieces of advice we've had to give. I have met throughout this pandemic with Scotland's faith leaders consistently and tried to explain to them as much as I can, and always had a very, very good hearing. In the short history of this pandemic, it has never been wrong to act hard and fast. Never. And that's the advice we gave. And that's why you see Scotland taking the decisions it's taking.
Alan Smith from Bauer.
Thank you, First Minister. Just on the issue of schools, I was wondering what you have seen or been told that gives you, confidence that the schools and councils are fully prepared for a period of online learning. And just secondly on this subject, Radio 4 has spoken with the head teacher of Clifton Hall School in Edinburgh, who's warning of a mental health tsunami, and says he's witnessing mental health issues unlike anything he's seen in 31 years of teaching. So can you detail what further support you're considering to help young people through this?
We have considered and will continue to consider what we have done since day one, the mental health impact. We've had briefings here dedicated to mental health with psychiatrists standing here talking about the support that's available. So this is something we take seriously, and like every aspect of this, we will consider on an ongoing basis what more needs to be done. Again, we've had briefings over the past few months where perfectly legitimately, the weight of questions coming at us here is, why aren't we closing schools? Teachers are concerned about schools being open, and everybody has heard the lengths that we have been keen to go to keep schools open. So what we set out before Christmas and then extended yesterday has not been done like any part of this. It's not been done lightly. I don't want young people to be out of school for a minute longer than is necessary, but two things have changed in the last few weeks. Community transmission is too high right now for us to think that we can have schools operating normally, safely. And back in August when we brought schools back, we always said a condition for schools to be open is a relatively low level of community transmission. We don't have that at the moment. And secondly, there is just still too much uncertainty, in my view, as a politician, in the scientific community about whether and to what extent this new variant is more prone to infecting young people. It's not, there's no suggestion young people are getting any more sick if they get this virus, but is it transmitting more amongst young people than was the case before? Now, there's mixed opinions on that within the scientific community as far as I can tell, but while that uncertainty is there, it would not be me acting on a precautionary basis, which with children more than anything is surely important, if we just carried on as normal with schools. But we want to get schools back as quickly as possible for all of the reasons everybody understands. And councils and schools have been working throughout to make sure that they have online learning. I detailed some of the developments on this in Parliament yesterday through the online learning collaborative that involves schools and local authorities with Education Scotland developing more suites of material. There is more live online learning options now available. And again, that is an ongoing process of making sure that as for every day that children are out of school, there is work ongoing to provide and enhance and improve the support that is available to them and to their teachers and parents. Do you want to say any more about transmission now? Fraser Knight from Global.
Thank you, First Minister. You said you've got 2,300 vaccinators registered at the moment in Scotland, and you're using GP surgeries, dental surgeries to roll it out. I'm wondering, is that going to potentially take resources away from what's already an overstretched NHS? And would you welcome the offer of volunteers to support the NHS in the same way that we saw during the first lockdown? And just for the National Clinical Director as well, just picking up on that point that the First Minister said about knowing whether this new variant spreads among young people. Can I just ask what is known at the moment and what's being done just now among the scientific community to try and work out exactly how transmissible this potentially is among younger people?
I'll hand over to Jason entirely on that last point there. On the first point, look, we have a situation, we're in a global pandemic. The pressure on our health service is greater than it has been in probably most of our lifetimes. I mean, I spent nearly 6 years as health secretary during a pandemic, the swine flu pandemic at the time. Never in the whole period I spent as health secretary did we go through a period where the pressure on the health service was as great as it is now. And that is just a reality. And part of the reason we are back in lockdown is to try to stop that pressure getting any more severe. And on top of that, we are about to, or not about to, we are already in the process of asking for the biggest vaccination programme in the country's history to be undertaken at pace. So clearly the pressures of that are extreme, but that's the job we've got to do. It's the job I've got to lead with government, making sure that we are supporting the health service to do all of that to the best of our ability. Yes, we are keen for, obviously taking account of the needs and the skills and the training for different people for different roles. We, yes, welcome people who want to volunteer their help and their expertise right now in all sorts of ways. And that's true in the health service, it will be true in the vaccination programme, and that's why I made mention of all the offers of help we are getting, and we will explore all of these. And while some of them may not offer benefits to us, regrettably, and we'll have to say thank you, but no thank you, there will be others that we do take forward, because this is the whole response to this pandemic, if you take it in its entirety, it's an all hands on deck thing. We'll only get through this if we get through it together, and all of us contribute, from staying at home when we're asked to, through to all of the different ways we can contribute, looking out for neighbours, helping in communities, contributing to charities, all of that. We all need to be playing our part right now.
So a couple of things quickly on vaccine training. Vaccines are a simple intervention, but let's remember there's still a healthcare intervention. So you still need a level of healthcare training to be able to do it, and you need people around in the vaccine centre with resuscitation training, with other things. So it's not as simple as perhaps it looks on the TV with everybody who has to be around that. That vaccine training happened over the bank holiday weekends that have just passed. There were people doing their training during those bank holidays with some of the Scottish Government staff supporting them. So we're getting those people up to speed just as fast as we can, and we're keeping pace with supply. In answer to your transmission in young people, we simply do not know yet, and it's a factor of the time we've had this new variant and the number of people who have caught to this new variant. And unfortunately, we kind of need that to work its way through so we can study the data. The researchers can look at the data, see how many young people got it in comparison to how many young people got the previous one. We then have the complication that in the place where it's been very prevalent, the schools were open and everything else was shut. So that perhaps creates an artefact that the most likely people to get it were the people out and about. So we have to work out if that's to do with their age or if that's to do with the fact they were just around the virus. That all takes quite a lot of time to come through the data. As far as we know just now, there is a proportionate increase in transmissibility of this virus. So if you're 17, it probably transmits easier, just as it does if you're 30. There is no evidence that it transmits more easily if you're in 4, 5 in nursery school, but we simply don't know enough yet.
Tom Eden from PA.
Thank you, First Minister. Good afternoon. In your response, I think, to Gordon, you were talking about the supply of the vaccine and potential wastage. Can I just ask why some of the doses are potentially going to be wasted and how you're going to combat or sort of minimise the wastage? And in response to, following up from Peter's question about travel, you said it's illegal to travel in and out of Scotland without exceptional reasons. Celtic Football Club are obviously in Dubai, or have been to Dubai for training. The club say it was signed off by the Scottish Government. Can I ask why? And on a similar theme, Donald Trump is reportedly thinking about coming to Scotland to avoid Joe Biden's inauguration. Do you have a message for him?
Okay, Donald Trump and Celtic Football Club in the one question. What can possibly go wrong? I ask myself. I'm going to try and, as diplomatically as I can muster, answer those two questions. On wastage, I'll hand over to Jason. Obviously, in any vaccination programme, in any sort of clinical programme, there will be wastage, spillages or whatever. Obviously, we try to keep that to a minimum, but you have to take account of that in any sort of calculation of demand versus supply. But Jason, from a clinical perspective, may be able to say more about that. On Celtic, look, I obviously saw their statement yesterday. I've kind of looked into this. I've not spent a lot of time looking into it this morning because I've had other things to think about. But as I understand it, we gave advice, the Scottish Government gave some advice to the SFA about the rules around elite training camps back in November last year. And, the world around the pandemic has changed quite a bit since November. We would not, it's not our role to sign off, agree or not agree what a football club does in terms of training camps. So we set out what the rules are. The rules have been, they may have to change given the changing nature of the pandemic, is that elite sports can go overseas for training camps if that's important in the context of their training for competitions. So that's, as I understand it, what we set out as the rules. For me, the question for Celtic, and I'll try to be diplomatic here, is not so much are they overseas at a training camp. It may be, given the changed circumstances in future, that won't be appropriate. But that's not really the question. What is the purpose of them being there? I've seen a comment from the club that said it's more for R&R than it is for training. I've also seen some photographs, and I, can only comment on what I've seen. I don't know the full circumstances that would raise a question in my mind about whether all the rules of what elite players have to do within their bubbles around social distancing are being complied with. So I think there are things there that should be looked into. Elite sport, and this is not just about Celtic or football, elite sport's been in a privileged position at many points over the past year, doing things that the general public can't do. And as long as that is the case, for reasons, because we all want our sports teams and people to do well and be able to train properly, but as long as that's the case, it's really important that they don't abuse it, that they use it for the purpose it's intended. And that applies to Celtic as it would to anybody else in that position. And if I haven't got myself into enough trouble there, Donald Trump. I've no idea what Donald Trump's travel plans are. You'll be glad to know. I hope and expect that, as everybody hopes and as everybody expects, not everybody necessarily will hope that the travel plan immediately that he has is to exit the White House. But beyond that, I don't know. But it's not, we are not allowing people to come into Scotland for without an essential purpose right now, and that would apply to him just as it applies to anybody else. And coming to play golf is not what I would consider to be an essential purpose. Right, now that I've dug, no doubt, several deep holes for myself in that answer, can you try and dig us out of them, Jason?
I'm going to avoid both Trump and Celtic, if that's okay with you. I would just say that elite sport has privileges, whether they are marathon runners training in West Africa or football teams or Formula One. They all have privileges to allow them to be at work. A lot of people this week have been told not to go to work. So sport needs to look at those privileges very, very carefully. And this news story is one such example. The wastage question is simply a matter of logistics and time and people. There isn't a lot of wastage, but in any process like this, particularly when the vial contains more than one dose, you are inevitably going to have either you don't have exactly the right number of people, or you might drop it, or the syringe might not work. There are very minor logistical things like that. And then somebody may not turn up for their appointment. And if that's in a mass vaccination centre, that's probably okay. If you've taken the vaccine out, for instance, to a care home, and you've reached the end and you've got 4 left, then it's tricky, particularly with the Pfizer one, to be able to use that in other people. So it's on the edge of using this vaccine, and we're doing all we can to, of course, use every single dose on people as much as we possibly can.
Scott McNabb from the Scotsman.
Yeah, thank you, First Minister. You've alluded earlier today about the lack of clarity you have around availability of vaccines, particularly the timetable, I think, beyond the end of January. And you're saying hopefully you'll get more information about flow of supply in the coming days. I'm just wondering, what is the lack of clarity down to at the moment? Does that suggest a frustration about feedback on the part of UK ministers or JCVI, or is it simply down to AstraZeneca's ability to make enough doses of the vaccine? And also, if I may, to the National Clinical Director, we've had the BMA over the weekend raising some doubts and concerns about the 12-week gap between the first and second doses. They think it's a betrayal to some patients, but also saying they think they may be at more risk, and there's a lack of evidence to justify the delay. I'm just wondering if you could respond to that, please. Thank you. I
will ask Jason to respond to that last point, because I think it is important that people hear a clinical perspective. I'm a politician, I'm not a clinician. I have considered very carefully the advice from the CMO, supported by Jason and others, around the dosage, and I am satisfied that that is a sensible thing to do to get the maximum number of people vaccinated as quickly as possible. But it's more important that you hear that from Jason. The comments I made about lack of clarity, they're not any of what you just described there. They're just the reality of where we are just now, with vaccines just being approved, with manufacturing ramping up, and just needing a bit of time to get clear on week by week what supplies we expect to have. If I'd been standing here, as I was standing here before Christmas, I wouldn't have been able to give you the information that I've given yesterday, because we wouldn't have known, that the AstraZeneca vaccine was going to be approved. We wouldn't have known what supplies we would expect there. So this is just in the nature of what we're dealing with. Vaccines that are being approved, the manufacturing schedules are being determined, and then that feeds through to our planning assumptions about what we will receive and when.
So the JCVI, for 30 years, the Joint Committee on Vaccination and Immunisation, for 30 years has provided completely independent advice to the UK governments about how they should vaccinate the public, about rubella, about COVID, about flu. We have never departed from the Joint Committee on Vaccinations advice, ever. In England, their advice is statutory. They cannot depart from it. In Scotland, because of the nature of the governments, it is not statutory, but it would be unprecedented for us to depart from it. They have seen published and unpublished data from both drug companies. They have used their expertise, the best expertise we have available to us. That's why we put immunologists, public health leaders, virologists on those committees, committees that most people didn't know existed until 2 or 3 weeks ago. They have seen data that says you get very, very good protection from one dose and you get elongated protection after a second dose. So they have made the judgment that the most important thing at this point in the pandemic is to protect as many people as we can with 70 or 90% protection as quick as we can and get an extra few percentage points and an elongation of that protection at a subsequent point at about 12 weeks later. We agree with them. That's the advice we gave to the decision makers and they agree to.
Okay, thanks. We are an hour into this briefing and I'm just over halfway through the questions, so I will need to be less verbose in my answers and speed up a bit. So Paul Hutchin from the Daily Record next.
First Minister, you've said that you expect that by the early May period that the over 50s will be vaccinated. And I think you've also said that you would like it to be faster than that. But of course, we're scheduled to have a Holyrood election campaign in April and in early May. Isn't it obvious that an election campaign at that time, which will be marked by party politics and not health, is going to be an impediment to the biggest mass vaccination programme in our history? And with that in mind, isn't there a clear and compelling case to delay that election until the autumn?
Look, I don't think there is at the moment, but I think perhaps the more important point is that this should never be a decision just for me, because it would be pretty invidious if I, as First Minister, subject to that election, could just decide unilaterally that we're going to delay it or not. We, as you know, the Parliament just before Christmas passed contingency legislation on a very much a cross-party basis that sets out the different steps that could be taken if the election cannot proceed as normal. But it would be really important that those decisions were taken on a cross-party basis, and of course the presiding officer of the Parliament has a role in that decision as well. Many countries have had elections over the course of this pandemic. There have been perhaps in some countries differences, more of an emphasis on absentee and postal voting than is normally the case. That may be required here. It may be, and again, this would be a cross-party decision, that we would have to change the arrangements for the election in some way or another. But I think it's really important that democracy continues. And yes, there are logistical challenges, and you can make the argument you've just made. I'm not saying it's completely illegitimate or that we should not consider these arguments, but particularly in a time like this, when so many people's civil liberties are effectively suspended, when governments are asking truly unprecedented things of people, then it's possibly more important even than in normal times that when there's a scheduled election for somebody like me to put myself before the public and say, are you happy for me to continue, that we try to let that happen as opposed to postpone that. So I think the election should go ahead. Standing here right now, I can't see into the future with 100% clarity, but that's my view right now, and I think that should be possible to do. But we're in a global pandemic, and but the most important thing to say is I think any change to the timing, or perhaps more likely to the arrangements around the election, have to be done on a genuinely collaborative and cross-party basis. Rachel Watson from the Mail.
Thank you, First Minister. I just want to go back to vaccines. We've heard from a 90-year-old man who has underlying health conditions, who's yet to hear when he'll receive a vaccine. Yet he has relatives who are younger than him in England who have already started that process. They've had letters and got the vaccine. What should he do? And when will people in the community start to get their vaccines and start getting letters to go for them? And secondly, can you guarantee that every person who gets the vaccine will have their second dose within the 12 weeks? I guarantee that no one will wait longer than 12 weeks for the second dose.
That's the advice, and that's what we will do. Can I guarantee that no single individual out of a population of 5 or almost 5 million in terms of the adult population, that no single individual will ever have an experience that doesn't match up to that. Clearly, I'm not going to stand here and do that. But the 12-week is the advice that we will be designing our vaccination programme around. In terms of the advice to the 90-year-old, I absolutely understand why you want your vaccine as quickly as possible. You should wait to get the invitation to come forward. The reason, and we talked about this at least one briefing before Christmas, is that we, in line with JCVI advice, got into care homes a bit earlier than in England, where they started to call older people who weren't in care homes earlier because of the logistical problems of getting into care homes. But everybody in these JCVI groups are going to be vaccinated. We are trying to work through the order. The group, the whole priority list is in order of priority itself. So at the top are the most vulnerable. And to put that bluntly, the people most likely to die if they get this vaccine. So we're working and we'll work through that methodically and as quickly as we possibly can. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on the point about the vaccination schedule. Towards the end of November, Jean Freeman outlined plans indicating all of Scotland's adult population could be vaccinated by the spring. But obviously yesterday you said that you hoped those on the JCVI priority list only would have received their first dose by May. What's happened in the last 6 or 7 weeks to push this timetable back? And also just ask, will you commit to publishing daily the number of vaccine doses being delivered to Scotland and the numbers being administered as a way of ensuring transparency?
I'd obviously want to kind of go and just check the sort of basis of that question. I'm not challenging it, but you know, in terms of the statements that have been made, because I don't have them in front of me right now. But what's changed? Nothing's changed. We are working on the basis where, if you go back to before Christmas, when no doubt whatever it was she said, Jean Freeman said that, we didn't know whether AstraZeneca was going to be approved in the timescale it has been. We didn't know. We had assumptions about supplies, both of Pfizer and AstraZeneca. Some of those assumptions have changed as they firmed up and gone along here. That's just the nature of what we're working in. We're trying to get the best information on supply that we can, then work out the timescales based on that. And when some of these assumptions have to change, so do the assumptions that are based on them. That's just the nature of this right now. And it's really, really important that the media scrutinise government on this, as in everything. But I think it's also important right now that media try to do it taking account of the reality of the situation we're operating in, as opposed to just this kind of whole traditional way of politician says one thing one day and something that sounds a bit different the next day, so politician must have mucked up. We're dealing with a moving and movable situation here, where we're trying to give as much information in as real time as possible, but being candid with people that it's subject to change as some of these things change, and some of what changes is out with our control. And I still think that's the best way to do things. I'm not going to commit to that right now. We will give as much information as regularly and as fully as possible. Right now we're publishing weekly information on the numbers vaccinated. We are going to try to make that weekly information more detailed in terms of the regional breakdown, the kind of breakdown of different groups of people vaccinated. And yes, we will consider going to a publication schedule that is more frequent than once a week. But right now, I want everybody working in our vaccination teams to be focused on getting this programme up and running, gathering pace, getting vaccines into people's arms. And therefore, there will always be a judgment. Is daily publication, is that adding so much benefit to the transparency and the ability of people to look at this, that it justifies the burden on people of gathering that data and publishing that data? If the answer to that is yes, we will do that. But if the answer to that is actually weekly or bi-weekly, may give us and give the public and the media what they need there in a way that is less burdensome to the people who are already under a lot of pressure, we'll do that as well. Go back to a question I was asked earlier on. We've got a health service working under incredible pressure. We've got the biggest logistical operation in a health sense that we face. We've got to allow people within all of the perfectly understandable demands about transparency, we've also got to make sure we allow people to focus on what really matters, which is getting these jags into people's arms. Tom Martin from The Express.
Hi, good afternoon. Thank you, First Minister. Could I ask why jury trials haven't been suspended as they were during the first lockdown in March? And what message would you have for anyone who's been cited and still being told to turn up to one of these remote jury centres in a cinema building, that it's safe to do so and that they won't get infected?
I'm clearly not going to give anybody in any context a guarantee that they're not going to get infected with the virus. This is an infectious virus. I will give people advice as to how they minimise the risks of being infected. We haven't cancelled jury trials because a lot of work has been done to allow trials to happen in contexts that take account of physical distancing and allow mitigations to be put in place. Can I say that we will never have to change that again? No, we keep these things under review. But anybody that's been cited for a jury should do what they are normally required to do and have an assurance that the considerations and the mitigations around infection control have been a really important part of getting trials up and running again. Alistair Grant from the Herald.
Hi there, First Minister. I just had a really quick follow-up question to the earlier questions about international travel. I think there were reports today that international arrivals to Britain could be required to show a negative result obtained no more than 72 hours before departure. Do you think that kind of thing goes far enough? Or do you think we should go further, such as some other countries have, requiring, for example, a test to be taken before departure plus a test on arrival and a mandatory quarantine of up to 14 days with no exceptions? What would be your view?
Look, we're discussing these things and we'll discuss these things in a four nations basis. So I'll set out what the outcome of these discussions are. I think we have to be as rigorous as possible. But right now, this virus is in the country already. So our focus has to be on what we have to do right now to suppress it, as well as obviously having a look and a consideration and a willingness to act to stop it coming into the country. But I'm not going to speculate when we have consideration and discussion already underway. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Just on the vaccine, if we're getting daily death figures, daily case figures, but we're only getting vaccine rollout figures once a week, how is the public supposed to judge who is winning the race that you've described there is between the vaccine and the rollout? And secondly, on online learning, Lindsay Patterson, the Professor of Education Policy at Edinburgh University, this morning wrote that Education Scotland has produced nothing but flimsy bundles of links to websites where other organisations have done the work. It says that there's a hastily rebadged version of a Gaelic website that is no substitute for active online teaching. How confident are you that parents and pupils will receive a much improved standard of online learning on Monday? Thank you.
I do believe that's the case. We keep that under review. I've not seen the comments you're quoting to me there, so I'm not going to respond to them directly. In terms of whether we publish weekly, daily, or whatever frequency, people will know in the case numbers that we're publishing whether we're winning the race against this virus or not. I'm not ruling out more frequent publication, but with the greatest of respect to journalists who've got a job to do and write stories and rightly and properly and importantly hold us to account on these things, I've got to balance a whole host of things right now. And I want the people we've got running this vaccination programme to be focusing on getting jags into people's arms. That's what matters in terms of the outcome of the race I'm speaking about. Of course it's important that we publish that, but we have judgments to make because we've only got so many people in the country that can do all the jobs that need to be done. That's true at any time. So we need to think, is daily as opposed to twice a week or once a week, is it adding enough additional benefit to justify the time that will be spent on that could be spent on other things. Now, I'm not saying one way or the other what I think the answer to that is. I'm just trying to explain to people the kind of balances that I've got to make when I'm trying to take account of everything. There's nothing more important right now than allowing everybody working in the vaccination programme to get the vaccine to people and get this race well underway with the vaccine gathering pace and ultimately getting over that finishing line. And talking of the finishing line, Helen Puttock from The Times is the last question today.
Hello. First of all, could I just ask about whether you might consider a regional return to primary or secondary school, depending on the levels in different regions? Obviously, even now, there are areas of Scotland which have lower cases of COVID than Glasgow did in October when shops were open. And secondly, we have had very brief answers about the quality of homeline learning and mental health support for children. You know, I am one of the parents who will be looking after 3 kids at home. I am one of the parents who saw mental health deteriorate during the first lockdown. And we know that CAMS services, who had referrals last lockdown, have still not been able to see some of those children because waiting times are so long. Are you really happy that that is the mental health service available to Scotland's children amid the terribly difficult time they are undergoing? Thank you.
No, I'm not happy with the mental health pressures on children or in anybody else, and I acutely understand the. Well, I don't understand it firsthand because I'm not in the position of juggling work with childcare, so I can't pretend to understand it. But I know people who are. My own sister is doing it. Many of my friends and family are doing it. So I get that, and everybody's mental health, without exception, everybody's struggling with aspects of what we're dealing with right now. I'm not giving brief answers in a sense that it's glib or I'm not taking it seriously. There's a huge amount of work underway. And sometimes when I give a brief answer, it's because to try to cover the totality of everything that's going on would take me too long, longer than I have here right now. I gave a very detailed answer in Parliament yesterday about online learning. We've had entire briefings here dedicated to mental health support. Perhaps, and I'll give this commitment now, we'll do one of them very soon, where we'll have mental health professionals here with us at the briefing to talk in much more detail about the support that is there for adults and children for mental health. We take this hugely seriously and we will continue to do that. In terms of regional approach, as I said yesterday, getting schools open as opposed to them being essentially closed as they are right now is not necessarily going to be binary. I think I said in Parliament in response to a question yesterday, and before I say all the things we will consider, that should not be taken as a definite statement of intent that we will do these things, but we will consider later on, could we get primary schools back, even if we don't think it's possible to get secondary schools back? Could we get some years back? We will, and that will apply to the regional approach as well. If we do think we could get schools in part of the country back, but not others, we don't want the areas where they could be back held back by the areas where it's not safe. So we want to get, even if we can't get all children back to all schools, and I still hope we can and by the 1st of February, but I can't guarantee that. But if that's not possible, we will absolutely be trying to get as many children back to school in as many schools in as many parts of the country as we possibly can. Thank you to all the journalists for questions, and we will organise a dedicated mental health briefing possibly next week to allow some of these issues, although in past experience when we've had them, not many of the questions that have come have been about mental health because there have been other issues on those days. But nevertheless, it's an important opportunity to just go into some of that in a bit more detail. I try to cover as much ground as fully as I possibly can at these briefings. Thanks to Jason for helping me today, to Yvonne for our BSL interpretation, and thanks to all of you for watching, and thanks to all of you for all you are doing and will have to do over the next period as we try collectively to get this virus back under control, as we start at a much greater pace to vaccinate people along the way. So we will have another briefing. We'll notify either today or Thursday, or perhaps both, but we will be getting back into a pattern of regular briefings from now onwards, and we'll make sure that they are notified in social media in the normal way. But in the meantime, thank you very much for joining us today.